The suburban areas were all designed for the cars, and the car came first, and so you laid out the streets first, and everything sort of fit in after the street.
The communities around here, we have many that can't be reached by sidewalk. We've seen that kids can't get around in some communities without getting a car.
The post-World War II model of building new roads as a simple means to alleviate congestion, as a simple means to accommodate economic development growth are just no longer viable options.
Transportation funding in general is in a crisis, frankly, and we as a region really need to think very carefully about where we spend our transportation dollars.
As part of the Achieve initiative, we actually decided to launch a movement in Portsmouth called Healthy Portsmouth. Our motto is Leadership, Partnership, Change, and we're really hoping that this is going to be an initiative that's going to take Portsmouth from where it is today as one of the cities in the state that has some of the lowest health rankings to one of the cities in the state that has some of the highest health rankings. We've got some significant concerns with chronic disease in Portsmouth. Our people here have stroke, heart attack, obesity at higher rates than other places in the state. We think we can change that by creating a healthier place for people to be able to walk more, exercise more, and have better access to fresh fruits and vegetables, to decrease exposure to secondhand smoke. And that's really what this initiative is all about, is looking at chronic disease and those things that contribute to chronic disease from the very youngest child to the very oldest adult here.
We here in the city of Portsmouth, instead of looking to build simply roadway capacity as a means to provide transportation alternatives, we're looking at building a transportation capacity. It's getting back to more of a complete streets mode, and that is providing different mode choices of transportation instead of just relying on the roadways.
We're trying to turn that around and have, okay, let's have sidewalks, let's have blocks that are walkable. And that's all part of the new urbanism, which is a big movement in planning.
It's so clear and it's very simple. When you have these livable communities, people can come out with their children, they can walk with their kids, they can walk to the park from their houses. I think that's the way I see it, and that could really help the health of our kids.
You can see where we're standing. There is such access to residential. It's the epitome of transit-oriented development. It's residential, you've got restaurants, you've got cultural and entertainment activities nearby. You can get on light rail and go to the doctor's office at the medical center and go to Harbor Park for a ball game. So there's a mixed-use environment that provides not only public health benefits in terms of walking, but environmental benefits, economic benefits. Companies and people want to live near vibrant transit systems.
We're going to have a much greater quality of life as we look to promote our neighborhoods, and as we look to have folks not just buy homes, but to buy into neighborhoods and to buy into that quality of life where they're going to want to raise children and want to walk to work and live, work, and play. That's what I'm looking most forward to, is that economic growth that will come with that, but more so that sense of place.